Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hi, in this video we're going to go through the de-escalation scenario for the OSCE exam. So this is one of your skill station and it is used in both the mental health and learning difficulties exam. It is 8 minutes. So for this station, you will be given a scenario which will be written on the paper, on a piece of paper. So just briefly have a look through that before you go to the patient. It will tell you what's happened and why the patient is upset. Very important to see what's going on. It also might give you there some examples of things the patient might like, so you can use them as an idea for distractions. So most importantly, in this scenario, you will have an actor that you will have to interact with. Obviously, you need to try and be as calm as possible. I know it's difficult in your exam, but remember it is an actor, so they're not going to hit you or anything like that, anything that might happen in real life. So as always, I'm going to advise you to look through the marking criteria. Having looked through it myself, as a general nurse, not a mental health nurse, I think it's all things I would pretty much do anyway, so it should be an easy pass, but let's go through it together. Okay, so firstly it says gains consent when entering the room. So you're already going to be probably in the room with the person, but just pretend. So is it okay if I come in? And then you're going to check the environment is safe. So obviously you're going to look around, but you need to verbalise you're checking it's safe so your examiner knows you've done it. So I'm checking the environment is safe. There's no hazards both for me and for the patient. Then you need to introduce yourself. So quite straightforward. Hello, my name's Beth. I'm the nurse here. Body language is non-threatening and relaxed. I think that's quite straightforward. Okay, so when you speak to them, you need to be obviously calm, clear and kind. You need to try and maintain eye contact and be at their level. Don't be like leaning over them or anything. So if you can, get them to have a seat with you, or if they're already sitting down, sit down next to them. Obviously if don't try and force them because you'll only make it worse. Okay, so it says to allow the person time to share their concerns, showing empathy. So just ask them about what's going on, what happened, and give them time to talk about it, whatever the problem is. When you're listening to the patient, it's really important to use what's called active listening. So don't just sit back and let them go on, kind of ignore them a bit, as we might be inclined to do. So you really need to listen and engage. So, giving eye contact, asking them questions about what's going on, repeating little bits. So I understand you feel that way, this kind of stuff. Just making sure that you're properly listening and you're sort of getting involved in the conversation. Obviously give them time to talk, but ask them questions and that kind of thing as well. Okay, so it also says offers answers to specific questions where able. So it might kind of be general things like, say, for example, the patient is upset today because they didn't have their favourite lunch. So, John, I know you're upset because we didn't have the fish and chips today. So let's have a look on the menu and see what days they're cooking that this week. After this, we'll go and check out what other things are available today. So these kind of basic questions just offer generic kind of answers and obviously stay relaxed. So once your patient's finished explaining to you everything that's gone on, it's a good idea to then provide some kind of distraction techniques, and this is also mentioned in the scenario. So hopefully the patient would have given you some ideas of their interest, or it would have been mentioned in the scenario, and then just work with those. So let's say in this scenario, John really enjoys his brother visiting him. So John, we can go and give your brother a call now if you'd like and see if he's available to come in and visit you later. Something along those lines. Just use whatever it is they've given you in the scenario. Okay, then it says to recap areas discussed prior to finishing your intervention. So John, I know you're really upset about the fish and chips, but let's go and see what other food there is, and we'll give your brother a ring. Is that all right? And then appropriately ends the intervention. So I'm going to go and sort those bits out now. If you need anything, just let me know, or you've got the bell here. And that is it for this station. It's quite straightforward, so I think you should pass, and good luck with your exam.